Today on Investigate TV Plus Weekend, IV hydration clinics popping up in storefronts and at events. We investigate the lack of regulation as states try to keep up.
And I think the problem is that it's become so prevalent that consumers make the assumption, well, surely if it's all out here, then it must be okay.
Plus, diabetics concerned coupons to keep insulin prices down could dry up as Congress looks to set a formal price cap for everyone.
You need to think about the little people and how it affects them and the impact that it has not only on their pockets, but on their health.
And a woman excited for her first baby loses her health insurance halfway through pregnancy after just one click of a button.
It's just crazy, for something so horrible and scary to happen and to be able to identify the 5-second moment where it all unraveled.
Investigate TV Plus Weekend starts right now. Hello and welcome to Investigate TV Plus Weekend. I'm Lee Zurich. IV hydration and therapy is exploding as an industry, with clinics promising to treat hangovers, vitamin deficiencies, and much more. But reporter Joce Sterman discovered regulations aren't keeping up, with critics concerned unlicensed and unsupervised providers might potentially put customers at risk.
Look on the internet and you'll find a virtually endless menu with options to solve any health problem you're dealing with. Trying to get pregnant? Want to feel more manly? Dehydrated? Dragging? Got a head-splitting hangover? We found the outrageous and the ordinary, with treatments advertising help for everything from Alzheimer's and Crohn's to cancer, Parkinson's, and the common cold. Websites claiming they've got it in the bag. At IV clinics and med spas that are popping up across the country, and at strip malls and parties, worker tents, and even poolside. Customers hooked up for what appears to be an easy drip.
These things that appear so casual in a shopping center, they can be deadly.
Absolutely. Absolutely.
Do you think the consumers out there understand that?
I don't think so, and I think the problem is that it's become so prevalent that consumers make the assumption, well, surely if it's all out here, then it must be okay.
As the president of the Texas Medical Board, Dr. Sharif Zafran, knows otherwise.
Because the way it is right now, it really is kind of a free-for-all.
IV and hydration therapy is a rapidly expanding multi-billion-dollar industry, and our national investigative team discovered it's operating in a medical gray area, with questions raised about what these drips can actually treat or cure, what's in the solutions and who's mixing them, and who's keeping an eye on the clinic owners, operators, and medical providers involved, if there even are any.
So as you see more and more of these places popping up, what are your worries?
So the main worry is actually who is staffing them, who is deciding what kind of hydration therapy is being given. It became really something that we took even more seriously when we had a death that happened.
All right, Texas 99, welcome back to another edition of the Dog Patrol. Buzz Russell here, getting ready for another big weekend.
Buzz Russell's world revolves around a microphone. The meters on his board are a heartbeat. It skips sometimes when he looks at an empty desk just outside his studio door.
Yeah, every now and again you look up and you just know that unfortunately it's not coming back.
A loss like this would hurt anywhere, but in tiny Fairfield, Texas, the death of a popular young woman was felt as far as Buzz's radio signal can carry.
It was a hit to the community.
Felt like a ripple effect.
It really was. It was like throwing a big rock in a pond.
Jennifer Cleveland was a rock to so many. The mother and wife had been a waitress at a roadside restaurant for years. The infectious smile she served customers built relationships and made her feel like a perfect fit for radio sales at Buzz's station. A new client, a med spa offering IV treatments, would be one of her first and her last.
You don't expect to get that call. And so now we're trying to figure out, okay, what went wrong? Something has gone terribly wrong. What happened? How did it happen? Is this real?
Reality hit hard July 10, 2023, when Jennifer visited her client, Lux Med Spa. Records from the Texas Medical Board show she got a fairly common IV infusion from the owner, whose attorney says she was a phlebotomist, the kind of medical professional who draws blood. Board records say the IV Jennifer was given contained vitamins and a dangerous mix of electrolytes known to cause complications. Just moments after the needle went in, Jennifer was unresponsive. Despite the owner's CPR attempts, within 2 hours, Jennifer was dead from a sudden cardiac arrest.
So the shock factor was pretty big for me. I'm like, no, people do this all the time. But once again, it's not as casual as we think it is. And in these situations where you literally have someone's life in your hands, there has to be a procedure.
But there were many missteps, according to the Texas Medical Board, which found there were no medically licensed or experienced staff at the med spa the day Jennifer died. The medical director was an anesthesiologist more than 100 miles away. The board said he failed to properly supervise the unlicensed owner, who was ordering and administering treatments that required prescriptions. The med spa, it said, had no medical protocols, policies, or procedures in place, something the clinic's attorney refutes.
So in the view of the Texas Medical Board and other medical boards, do you see this as the practice of medicine?
Absolutely. Even if it's just IV fluids by itself, those are prescribed medications.
But that's not how it's handled across the board, with some states admitting they have no rules or regulations to guide the industry. Our national investigative team looked at state laws across the country and discovered those that do vary widely on who can own or oversee these businesses. What licenses are required for practitioners? What monitoring or physician relationship is required? Even who's allowed to ultimately stick in the needle isn't uniform.
Some observers are calling these treatments the Wild West of medicine.
The Federation of State Medical Boards is playing sheriff, trying to wrangle an industry that answers to different masters. The organization called a meeting in April to talk about the challenges posed by regulating IV therapy and hydration operations, which could involve doctors, nurses, pharmacists, and business owners, all with their own licensing, regulation, and oversight.
These things are coming up faster than the states have been able to come up with laws to address them specifically.
In just the last 3 years, we found medical, nursing, or pharmacy boards in at least 8 states, including Alabama, Mississippi, and Nebraska, have issued specific position statements to lay out exactly who could do what when it comes to IV therapy. They're not laws, though. They're merely guidance that even boards admit doesn't carry much weight. Still, industry insiders say it's a start.
I think they help quite a bit. I think it empowers us as physicians and as practitioners to say, okay, we see what you need and what you want. We will build around that.
Dr. Chris Seitz is an architect of the IV therapy industry.
I've got an emergency question. I'm going to send this conversation to the clinic.
He runs Guardian MD, a company he says is designed to help businesses nationwide navigate the complex rules that come with running an IV clinic in their state. Seitz also sits on the Scientific Advisory Board of the American IV Association, a group created by the industry. Just weeks ago, it released a framework to raise industry standards with the goal of protecting patients.
Done the right way is very safe. Not done the right way, there are risks.
Risks that may get blurred in a social media world where IV clinics pop up in your feed as casual beach setups and cheeky after-party pics. But no matter where the drip happens, Seitz and the IV Association say there have to be clear protocols in place. Providers have to be properly licensed and stick within the boundaries of their scope of practice. And he says it's key that there's an actual medical evaluation done on anyone who seeks out IV therapy, with the benefits and risks clearly laid out.
We believe as a scientific committee that there needs to be a patient-provider relationship established. We really don't want, and the boards don't want this either, somebody coming in off the street, looking at a menu and saying, hey, that sounds good. No, we need to be having a relationship.
That's where remote or telemedicine comes in. It became a norm during COVID, and it's something Seitz says his company relies on as it connects medical directors to IV clinics, while limiting how many they can oversee from a distance. But not everyone is operating to his standards. We found doctors across the nation disciplined for failures related to remote oversight of IV clinics, including the doctor medically directing the IV clinic that injected Jennifer Cleveland. His license was initially suspended, then restricted, with the board calling him a continuing threat to public health and safety.
There has to be accountability in this because we're talking about people's lives.
People like Jennifer Cleveland, the waitress turned saleswoman whose life was lost, simply trying to support the people who supported her.
She loved people, very outgoing, very loving. And so, yeah, if you're gonna do something, be like Jen, love like Jen, be a light, and that's what she was.
Our team repeatedly contacted the doctor overseeing the clinic involved in Jen Cleveland's death, but got no response. His license remains restricted, and the case is now being investigated by the Texas Attorney General. The med spa's attorney says there's no criminal liability that should be attributed to the owner, with no proof the IV treatment is responsible for her death.
Coming up, it's a life-saving medication needed to keep millions alive, but one that's often unaffordable. A look at Insulin Deserts and a push for solutions after the break. Our in-depth coverage continues. You can get connected to Investigate TV Plus on all social media platforms. Welcome back to Investigate TV Plus Weekend. Millions of Americans have diabetes, but many of them have a difficult time affording insulin, the medication needed to keep them alive. The largest insulin manufacturers recently capped the cost for insulin at $35 a month, but it's voluntary and the pharmaceutical companies can rescind it at any time. Reporter Andy Parati looks at Insulin Deserts and a proposal to cap prices for everyone.
Okay, in this bottom drawer is all the medications I take for everything.
Charlene Davis shows us a drawer full of drugs to keep her alive.
High blood pressure, high cholesterol, heart failure.
Over the past few years, doctors amputated fingers from her left hand and implanted a heart monitor, all connected to a chronic disease, type 2 diabetes.
It's a job, and that's why I tell people it's a job, because you have to maintain, I got enough strips, I have enough needles.
The Atlanta resident has insurance but relies on manufacturer coupons to afford the insulin at $35 a month to manage her diabetes, a discount pharmaceutical companies could rescind at any time.
It would probably cost me $500 a month. It would be hard. We don't have a lot now, but we really wouldn't have anything at that point.
According to this 2023 bipartisan U.S. Senate report, Charlene is one of millions of Americans who live in or around insulin deserts, 813 counties with high rates of diabetes and the uninsured. In Georgia, that's more than 100 insulin deserts, 53 in Alabama, and in Missouri, it's 42 counties identified as insulin deserts.
This is Basagol.
But it doesn't cover diabetics like Charlene with private insurance.
I think it needs to cover everyone.
Did Congress go far enough to help everyone with diabetes?
I'm glad we were able to cap it, but no, I'm not satisfied. I think insulin should be affordable for everybody.
U.S. Senator Raphael Warnock of Georgia led the charge to the insulin price cap for seniors and has been working to expand it for everyone, with or without insurance. The lawmaker sharing this story this past November about a constituent who took to extreme measures to find affordable insulin.
I spent time with a young woman in my state named Lacey, who as a graduate student was meeting people on Facebook meetup groups and then meeting them in dimly lit parking lots at the local Chick-fil-A to get insulin.
Definitely not legal, but honestly, it saved my life on several occasions.
Lacey McGee is that constituent. She attended the 2023 State of the Union as the senator's guest to raise awareness about insulin price disparities. Today, she can afford the medication, but only thanks to her husband's insurance.
So there's still a big gap for people that are between jobs or don't have insurance, and a deadly gap in many cases.
These are the kinds of stories that I've heard in my state, across the country, and I'm glad that we're on the path to doing something about it.
Congress feels like it's perpetually in gridlock. Do you think you can get this over the finish line?
I think so. I'm seeing hopeful signs. Look, I'm under no false pretenses that any of this is easy.
This is taken every day.
Millions of Americans in need of help to afford a medication they can't live without. What would be your message to Congress?
You need to think about the little people and how it affects them and the impact that it has not only on their pockets, but on their health.
You can stream this story and others from Investigate TV anytime directly on your television. Download our free app on Roku, Amazon Fire, and Apple TV devices today. Up next, a woman loses her health care coverage in the middle of her pregnancy. Why she found herself in that unreal scenario, and if it could happen to you, coming up. Welcome back to Investigate TV Plus Weekend. A woman halfway through her first pregnancy finds herself dealing with a complication she never expected. Her health insurance abruptly canceled. She uses the healthcare marketplace created under the Affordable Care Act. Reporter Angie Riccono in Kansas City explains why just one click of a button turned her life's plans on its head.
It's just crazy, for something so horrible and scary to happen, and to be able to identify, the 5-second moment where it all unraveled.
Claire was updating her married name and providing documents. She needed help logging in. She called the 1-800 number for help.
Welcome to the health insurance marketplace.
The navigator on the other end reviewed her policy and encouraged her to update pregnancy information too.
She said, yes, you have to, update it to show any changes.
Claire clicked yes and revealed it's one baby for this pregnancy, her first baby. It all happened so fast, Claire didn't realize it was optional information.
And I was just following, instructions, speaking to the person who answered the phone at Marketplace, trusting that she would tell me what I needed to know and guide me the right direction.
Claire's health care was immediately terminated.
I was reeling. I was shocked. I had no idea that this was even a remote possibility.
No one alerted Claire to the fine print. If you want to keep your current Marketplace coverage, don't report your pregnancy to the Marketplace.
You probably are going to qualify for Medicaid because you're pregnant. And she just made the whole thing sound way simpler than it really was.
Simple left the equation 5 weeks ago.
I've had times I'm just sobbing on the living room floor after getting off the phone.
Claire lost coverage at 15 weeks. She's now 20 weeks pregnant.
I've had to delay or skip genetic testing. An ultrasound has been delayed at this point. And that's in a simple, uncomplicated pregnancy.
There was no reason for that to be canceled, and it should not have been by their own guidelines, by the government's own guidelines.
Insurance broker and expert Carrie Hall says fixing a government error like this is complicated.
It's very difficult. Anybody knows if you've had a dealing with the government, let's say it's the IRS or it's Social Security or any one of those agencies, trying to go back and unwind the mess is extremely difficult.
We connected Carrie and Claire. She's now armed with information. She's pushing back on losing her coverage, pointing out she picked a policy, then got pregnant more than a month later. Carrie promises to help her.
And we'll bring the Department of Insurance in, which then would go after the federal government in this particular case and say, you can't do this to her.
In the meantime, she's going public to warn others.
This isn't something that just happened to me. This is reality for thousands of women in our country. You could have your health coverage terminated with a moment's notice simply because you notify healthcare.gov, the marketplace, that you've become pregnant.
While Marketplace refused to comment on any individual situation, Claire says her insurance was eventually reinstated. Coming up, for decades, people have accepted the care doctors recommend without knowing the cost in advance. But federal rules now require hospitals to publicly post prices. How price transparency helps patients find lower price care and compliance challenges after the break. You can watch Investigate TV Plus anytime online. Just subscribe to our YouTube channel at Investigate TV. You can catch stories and full episodes. A federal law requires hospitals to put its procedures costs online, but a report by a consumer advocacy group found price transparency is still a work in progress. Carice Jackman spoke with healthcare advocates about the importance of posting the price and what you can do to help save money in this week's Watching Your Wallet.
You know, when you go to the grocery store, you can see the price of milk on the shelf, you see it when you check out at the cashier, and you see it on the receipt when you go out. But that's not possible in healthcare.
Giving patients access to hospital prices is why healthcare advocate Mary Beth Garino wrote the Post the Price report. She says patients should be able to get an accurate look at what the price of care is before they see a doctor.
Patients, as consumers, have a lot of power over purse strings and the power of a consumer to decide where to spend their healthcare dollars, but they can't do that if they don't know the price.
Since 2021, federal rules from the Centers for Medicare and Medicaid Services, or CMS, require hospitals to make their prices public in two ways: in a machine-readable file for researchers and in a consumer-friendly format as a price estimator.
How does it look at 3 years after that?
It's iffy, honestly. We expected to be able to compare prices that were reliable, and unfortunately, there were some hospitals that still weren't even providing prices for procedures that we know they offer.
Garino and her team at the U.S. Public Interest Research Group, or PIRG, looked at prices for a knee replacement surgery at 27 hospitals in the Cleveland, Ohio metro area.
And we found a huge variation in prices when it came to the cash price, and a smaller but still significant variation when it came to the insured price.
Some only had downloads of complicated files you'd need a special program to read.
Our national investigative team did our own analysis on hospital prices, spending months trying to find price information at 74 of the nation's largest hospitals. Of those, 77% had a tool designed to help patients determine hospital cost, as well as a comprehensive price list.
So there has been improvement. And I think that the updates to the rule this past December will help as well. But I think now we need to focus on the reliability of the information, not just the access to it.
As far as what patients can do to help themselves, Garino says if you're paying through cash or without insurance, there's a requirement called a good faith estimate. If your final bill is $400 or more than your estimate, you're entitled to dispute it. You can also ask your insurance company how much the procedure will cost you out of pocket.
I think the more that we use these tools, the more that we ask hospitals for prices, the more likely we are to move closer to accurate prices.
And that's it for us. Thanks for joining us here on Investigate TV Plus Weekend. Hope to see you next week.